Thank you so much for staying tuned. It's still the conversation here on Lagos Television. This morning, we'll be taking a look at health management and the influence of social media. Since the advent of social media, especially in most recent times, everybody has suddenly become a health practitioner, a doctor, a nurse, an advisor, giving health tips and going as far as prescribing medications and even sounding so authoritative and so sure that such medications are able to cure not only one ailment but several ailments. And today on the program, of course, a doctor is joining us to help us take a look at this trend, why it is becoming worrisome and why it must be nipped in the bud as fast as possible. We have in the studio this morning Dr. Mohammed Isa is a medical practitioner. Doc, thank you for being here on the program this morning.
Thank you very much. Good morning. It's been a while. Happy New Year.
Happy New Year to you too. Yeah. Let's start this way. Before the advent of social media, or before everybody started deferring to the social media, it was more or less like if you had any ailment, if you had any symptom, the right thing would be to approach your doctor, especially the general practitioners. What shifted? At what point did we get to that space where you probably need to even consult the social media first before looking for a practitioner?
Thank you very much. Human being evolves on account of needs. So based on necessity, human beings tend to keep exploring options.
Okay.
And imagine our forefathers who don't even have access to doctors. They consult their traditional healers and prescribe herbs and things for them. And they respect them so much that nobody goes to the bush to cut any trees or any leaf without consulting with them. Because if you do that, the moment they see, they say it will even not work. They put the traditional caveat on it that if it is not him that gets it from the bush, if you are the one that went to get it, it will not work for you. So on account of that, people respected those particular field, and nobody goes to the bush to cut any tree or any leaf to do anything then. But as time goes on, begin to understand, believe, okay, this dongoyaro would work for me. So everybody begin to plant dongoyaro in their backyard, and they begin to use it for themselves. So stop going to those baba again, asking them for the same herbs. So the same thing apply when the world is increasing in population. Now, disease entity also keeps coming more and more complicated on account of the fact that people do not have a way around those illnesses. And people get worried. If my father is sick, I'm looking at him on the floor, I don't know what to do. That's the major factor, first. Number two, the environment also promotes that in terms of economic strength. Now, considering the fact that going to meet a doctor or looking for a healthcare system is a bit expensive for the typical Nigerian setting.
Okay.
And then look at, okay, what other thing can I do?
Right.
Okay, can I meet someone who have an idea of what's wrong with my dad? Okay, your dad is not standing up, is not eating very well, cannot sleep. Okay, there's a man that also told my dad to use something last week. Can you just try it? Then that also started. Gradually, we move from there that instead of me looking for my friend that will tell me a drug, I have my phone in my hand. If I check Google, or I check ChatGPT, if I check anywhere, please, an old man that cannot stand up, cannot eat very well, what can I do? And that gives long list of things. And we get to see that more, especially our young generation have now developed an attachment to that more than hospital. But I can tell you, even in the world of technology, they try to replace doctors with a robot, with some artificial intelligence and co. But it's been found that it's not going to work.
Right.
So, and what we found in the hospital is that after they've gone through the Google and either they are scared more than
they got in the first place, yes.
Or they become complacent thinking that it's not a big deal. By the time they get to real doctor, they realize that they have committed gross error.
Right.
Most of the time they come with complications or they come with, in fact, as I speak with you, somebody just spoke with me, he's a lawyer who has consulted the Google, has collected drug for diarrhea, and has been using the drug for the past 5 days, and the rest not going. And because he has a boil also, and he just called me before I entered the studio. that instead of diarrhea to disappear, diarrhea keep increasing.
Wow.
But the boil has disappeared. I said, what's the name of the drug you mentioned? I said, that same drug will give you more diarrhea.
Wow.
He said, but no, that's what he found on the Google. I said, that is Google doctor.
You need to, yes.
So he now went to read the leaflet of that same drug and confirmed that that drug also will cause diarrhea. So, but look at his problem.
Yeah.
Thinking that because he has a boil under his leg and he has diarrhea, so the drug will do the two jobs.
Will work for both.
It led to a catastrophe for him.
So from what you've said now, Doc, let's also look at, because can this also be one way or the other be categorized as misdiagnosis? Because if you think that you know what is wrong with you via your consultation with ChatGPT or Google or any other person who is not a licensed medical practitioner, is it possible that also, like the example that you gave shortly, that something else could actually be wrong with you, but presenting like symptoms to other things? And so again, it's just like having some kind of malaria and then you're presenting with headache. And perhaps it is not, it's just a coincidence that you're having headache. You are probably suffering from something else. So let's look at the kind of misdiagnosis that these other unlicensed means of diagnosis can actually lead a patient to.
Yes, of course. It's not about misdiagnosis. When you talk about misdiagnosis, it's even with the doctors. Doctors can actually have misdiagnosis.
Okay.
But this type of you are talking of is not even misdiagnosis, it's wrong diagnosis.
That they don't even know at all.
It's wrong diagnosis.
Okay.
And let me give you an example. When you talk of fever or having temperature, there are over 20 things that can cause temperature.
Right.
And generally in Africa and in endemic zone like we are, the first thing you must think of is malaria. This is one of the reasons why there's a warning that don't take anti-malaria until you have been tested. And people just don't believe that I have fever.
Yeah.
Let me just take anti-malaria. You take the anti-malaria and yet the fever, the freeze disappear. Okay, what do you do next? The next thing in our environment is typhoid. That's the next diagnosis. Okay, he will go and buy one drug, they call it for typhoid, he will use it, and yet the temperature persists. Unfortunately, he's not aware that maybe you have a liver abscess. You have amoebiasis, you have temperature. Okay, he doesn't even have that, he has a mild cough. He's about having a full-blown tuberculosis, he's running fever, and he's thinking it's malaria or typhoid. So you can see this is not misdiagnosis because you have fever and you believe all the time you've been having fever, it's malaria. One day, it may not be malaria, it may be sepsis. Okay, it may be more than that you are unable to identify. But meet a trained doctor, tell him the pattern of the fever. By telling the doctor that it's more in the morning, but less in the afternoon, he knows what you are saying. Or it is more in the afternoon, but less in the evening. He knows another difference. So the training, if you have been trained to manage symptoms, is different from somebody that Googles symptoms and find an answer to it. You always make a mistake, I can assure you that. Some have gotten away with it because coincidence, it worked for them, and they get away with it believing that I don't need to see a doctor again.
Right.
But I pity them that they end up lying on the bed in the hospital after they have complicated their lives.
So when we talk about the social media, of course, there are different, different things that constitutes the social media.
Exactly.
Of course, we talked about ChatGPT earlier. We talked about Google. Of course, there are other channels. Those who also use some, friend-making channels. And of course, so when you also get involved with some of this information on those channels, would it be safe to say that because the internet or technology has made information really accessible, is this an abuse in a way?
Of course, it's an abuse. It's an abuse and it's an overuse and wrong use.
Okay.
You see, technology is supposed to aid life and support life. So when it becomes counterproductive, it means it's now a problem. Now imagine somebody be on Facebook or Instagram telling you that when you use this particular thing, is going to take care of so thing, and you ask, how did you arrive at that? You tell that Mr. Lawanya have used it in Sokoto, it worked for him, and one woman used it in Enugu and it worked for him, and there is one woman in Ijebode, he has used it and everybody is okay, and you want to follow that. Medically, any drug a doctor tells you to take, if you go back into research, that drug will have been researched on animals, then on humans, before arriving at the dose and before coming to prescription. So the doctor do not need to tell you that one woman is in Canada, it works, another person is in London. No, it doesn't need all that, because that drug must have gone through the first phase, second phase, and third phase of clinical trials, and then conclude that this drug does this. Okay. So, but people want to make money. I use the economy as a major factor to the misuse of social media. Now, the economy, those that are making use of it, they want followers and they want to make money. And those that are also patronizing them also are looking for shortcuts, are thinking that the shortcut get to the answer, but eventually become a longer cut for them after to discover it's a complicated situation.
Yeah. So let's also talk about practical life experiences where patients have had to rely solely on social media diagnosis for their ailment, how be it difficult or not difficult, and they eventually had to land in the hospitals, perhaps after complications or when they noticed that, you know, that ailment wasn't getting better. Right. So take us through, are there patients that you've had Herculean task convincing that what their social media doctors told them isn't what they are quite dealing with? Because again, some people are so attached to the diagnosis they get from those mediums than what a real-time doctor is telling them.
Exactly. We get to see that a lot, several times. In fact, I don't think I can make a list of that.
Wow.
But let me remember just one that happened some times ago. As a young man with his wife was pregnant, and to him, there's a pattern of what the Google told him that the woman can take. So he always comes to the hospital and tell doctor, yes, he said this lady should not take folic acid now because the pregnancy is now. I said, on what basis? He said, no, that's what I know. Well, that's what you know. Okay, let's check. We check the woman, we check up and down. This woman is having low blood level at 28% and pregnant. So, sir, this woman will need to take this blood tonic and other. He said, no, she's eating ugu and eating everything very well. We said, hey, Mr. Alagwaja, can you just calm down, let this woman take this drug? Eventually, he agreed. As we progress, even up to delivery time, this man was still on top of us, telling us that, no, Google said no, she cannot deliver this week, it's going to be in another 2 weeks. I said, okay, somebody's in labor right now, and Google told her it's going to deliver in 2 weeks' time, and then she's now in labor. He said, doctor, there's no way she can deliver, because Google said by calculation, she's going to deliver in a so day. I said, okay, wait now, let's see what's happening. After like 2 hours, the woman cannot even bear the pain. I said, okay, fine. Oga, Mr. Google, this woman have to enter labor room, and then what do? Do we ask you to follow, how to follow you home, and then bring her back the day Google
is telling you?
And it took him so long before he could agree with us, and that wasted a lot of time. So eventually, the woman entered the labor room and delivered. So after dawn, this same young man came back to acknowledge that, hey, I am an ICT person, and I'm so much attached to all the social media thing. I think I have learned my lesson in this, my wife delivery.
Right.
So it's a typical one. In fact, he sent a message to us recently, acknowledging that if he had not agreed with us, he would have lost that woman. So we have a number of that. That is for delivery. You have some medical issues too. Now, just yesterday, I was talking to a woman who claimed she's having pain in her tummy, and the pain now is transmitting to the back, and she has been treated before for ulcer, and now she's not getting better. And I said, okay, what do you know? She said she's looking for a test that can check the whole of her body. I said, how did you get that? I said, that's what my daughter told me, that go and tell the doctor to write a test for you. They'll check the whole of your body so they can discover
what exactly is going on.
I said, what led you to that? He said, okay. You see combination of ignorance and social media again. So, and I said, do you have 500,000? I said, 500,000? Yes. Let's just do the MRI of your head, MRI of your chest alone, not even the tummy. Or we now do the three, head, neck, and tummy. Maybe 500,000. Mama said, I cannot
pay 500,000.
She now took her phone and called. Silifa! Silifa! So I was now wondering where Silifa got the diagnosis of running a test of the whole body to discover what is causing pain in the tummy that transmits to the back.
Right.
So that's social media.
But were you able to, at the end of the day, find what exactly was going on with her?
In her, definitely what was wrong with her is age.
Okay.
And again, the job she does has affected her bone at the back. She's having lumbar spondylosis that's giving her pain, and she has ulcer. So when those pain come at the same time, it's like that something is transmitted somewhere, and she feels something is moving. Say nothing is moving. You are not even pregnant. You are 64. What's moving in your body? So that's when they have neuropathy. That's feeling when nerves have been affected. They have like something is moving, or crawling sensation, or peppery sensation in the body, or have vibration, or numbness, or paresthesia. When they experience all that, that means that somewhere, somehow, a nerve has been trampled upon.
Okay.
Either from the spinal cord or from the vertebral column, something has transected anywhere. And that happens, we understand as doctors, and we give them medication to manage nerve regeneration over time.
Okay.
And they are able to allay their fear that it's not something that goes immediately. It's going to take a while for you to get better on that.
Right.
They will take care of the pain immediately, and they get better. For those of them that eventually listen to us, they get better and come to acknowledge us. But for those that are addicted to it, they are still there. In fact, as we speak, some are still waiting to get a response from ChatGPT as we speak.
Right. From what you've also mentioned now, given an example of that elderly woman who, after hearing 500,000, came back to reality.
Exactly.
Is this also a reason why a lot of people are dependent on the socials, the high cost of medical attention, the high cost of medication? Because at the moment, medication is really expensive from what it used to be. So the high cost of, seeking medical care or medical attention, is that also subtly pushing the people away from seeking proper medical attention?
Yeah, like I said in the beginning, you see, the law of necessity actually push human beings to exploit everything that's possible for them. It's until when it causes them death, and then those alive now realizes. So in the law of necessity to survive, survival of the fittest, now I've gotten to the point whereby, okay, we're taking of drug expensive. Tell me what is not expensive as we speak now.
Right.
The only thing that is free now is the air we breathe in on the streets.
If you're not careful, someone will charge you for it.
So imagine, so if that's the case, so virtually every other thing is expensive. And therefore, healthcare system all over the world still remain expensive. The unfortunate thing that I pity Nigerians is that the insurance system is not working, whereas in other countries it's working effectively. If Nigeria with NHIA till now for over 10 years of practice, we cover only 8.4%, and Ghana is covering almost 68%, Kenya is covering almost 94%. So what are we talking? And that means an individual can access a good doctor without having to check his pocket first.
Right.
So once human being can know that I can see a good doctor without me dropping any kobo, it's taken by my insurance, then all these things we're talking of will not have happened.
Okay.
So there's need to emphasize insurance scheme for people so that they can actually access health, and then they see good doctors instead of patronizing social media, and then they can get the right information and right guidance. Okay. Otherwise, imagine a 32-year-old girl, somebody having a very big mass breast of breast cancer at 32. And we asked her what happened. She said, it happened about a year ago, the breast getting bigger. And what did you do to it? I went to one woman, he said I should be rubbing something on it. And is it going down? I said, no. And what, you waited to this point? And he said, yes, when she Googled, and they said it will go down itself. You should just keep applying something. So you can imagine such a person, if she's not careful, she's going to lose the two breasts at 32, not married, no child.
Right.
So it is only when people around her that will learn that particular thing in a hard way. But do people need to get to that point to learn in a hard way?
Right.
It may be expensive, but I can tell you, quackery and wrong approach is more expensive than going through the right way.
Right.
Because if you go through the right way, it may look expensive in your presence, but you get to the point of salvation and you're happy.
Right.
But the wrong one takes a longer way, you spend all your money, and yet end up complicated.
Right. Is it all bad news about the social media, or are there some positives that, the socials also may present?
Oh, definitely. Some of us are on social media to teach. We still do health education by enlightening people about what they should know about themselves. A lot of young doctors are online doing all of that. So for those that really want to learn, they follow such people and learn things that are real from real doctors, not a robotic or somebody that's a quack that just want to make money and create a page and be able to create something that fascinates people so as to watch his pages. Somebody was telling me recently that he called on me and said he liked my page, that he's a health blogger, that he can promote this and promote that. And I said, what's your background? And he said, he's your member, he's a journalist. Oh, okay, so when they now become a specialist in medical, he said he's been on it for quite a while, so he's well-grounded in health promotion. I said, okay, you can promote health, but you cannot be diagnosing and treating people.
Right.
He said, no, that he has gotten to a level that he tells people what to do, and then it worked for them. I said, you have achieved all that by guesswork or by some of the things you also copy from somewhere. You have not gone through the training.
You're not licensed to do that.
You didn't go through the training to do that. So, but social media has its good side for those that really want to explore the good side by also following real-time doctors that explain things that they need to learn and then reach out to such people to get facts of what is wrong with them.
Right.
Rather than depending on one engine that's giving you an answer that you cannot see and they're telling you what's wrong, or those people that create a kind of video. Now, in those days, I was telling my son just this morning that in those days, when the Yoruba film something disappear, we used to be wondering, how did they disappear? But now with technology now, our children are growing up to know that people can disappear. With technology, this cup can actually move away from this table and not seen again. And children are growing up to be, I can disappear. Disappear to where?
You can use AI to disappear.
Social media make him believe.
Right.
So social media has created a kind of a image to people that you don't need a doctor. Just Google it, give you answer what to do. Go to the pharmacy and buy it and use it and you'll be okay. But when they do not get okay, they start looking for the real doctors.
Right. So let us look at, again, we've identified that perhaps the negatives will definitely outweigh the positives here.
Exactly.
I'm talking about, the use of the socials, especially for people who are emphatic about their medication, curing many ailments, and you also having access to them, helping you to overcome your challenges. But then also sometimes we have NAFDAC also warning people that don't patronize unauthorized unauthorized how are they called now? Manufacturers or licensed individuals who also would want to use the socials to sell their product. But for you as a medical doctor and looking at the damage that this is causing, especially on the health of Nigerians, would you wish that, there were strict penalties or strict regulations again, barring people from making unconfirmed, even though, yes, it's their right, but one person's right stops where another person's begins. So would you wish that there were stricter policies or penalties for people who lure or who misinform people to patronize them?
Okay. In a simple term, we are so scared about the banditry and Boko Haram in Nigeria, the number of people they kill. But I can tell you that there are people that live with us that kill more than Boko Haram and banditry. Because manufacturers that make a fake drug, or those that went to change expiry date of drugs, they are worse than Boko Haram in real time, because people will be taking those drugs and be dying silently without anybody knowing that someone is behind them killing them. So if we come from that angle, NAFDAC should even go further. I've not had where NAFDAC has prosecuted any company to a point of conviction. I've not had one before.
Okay.
I mean, I have to go and check their page if I'll have any such history. But there's need to use some people as scapegoats.
Right.
We pray for Dora Akuyili. In our own time, I think most of them were scared and they do not try that as much as possible. But now, you have all sorts of drugs, also unlicensed people that claim and so many nefarious or unwanted things that's not possible, all in the name of financial gain.
Right.
So, but if NAFDAC can actually go into some of those things, my concern with NAFDAC is this. Now, a product can be seen to contain what is normal. But the question is that, do NAFDAC went further to test the toxicity of those things combined together?
Okay.
Because that's what we face so much in our society, where people will have one or the other develop a complication of a drug and then present to a doctor with a complaint, And doctor will run all the tests not to discover anything. But from the history, I've been taking diclofenac for the past 3 weeks. Diclofenac, and then you now say you have ulcer. So who is supposed to have ulcer if it's not you?
Right.
Okay? So, and when you now check the drug you're talking of, I just use the word diclofenac. There's so many unlicensed drugs in the society. They call some names that we doctors will be asking ourselves, hey, have you heard of them before?
Who is the manufacturer of that?
And you check, you will not get the name of the manufacturer, no address, no contact, no label, no code, nothing to trace. And that will have a lot in our society. I think NAFDAC should go further to prosecute such people to the level of conviction and then use them as a scapegoat so that others will stop doing that. That's a problem.
All right. Also on the socials, we have a lot of influencers because, I mean, that's also a job, people who influence. And they have a lot of influencers who also give health advices, health tips. How important is it for them to, again, for the influencers to demarcate a simple advice to a medical advice? Because, again, some people may want to use their own experiences and what worked for them. But then there's a difference between you saying, well, this worked for me, than wanting to cajole people to go through that same route. So what makes an influencer, again, because, and then some will also be wise to say at the end of the day that this is just about me, this is just an experience, and not necessarily me prescribing something to you. So what should the role of influencers be when they do things like that? Because we've also seen that some people actually have them market this product. So where should the demarcation be as to you giving a healthy advice or what worked for you, or you marketing a product?
Okay, for the influencers, they're also looking for livelihood, which is, like I said, you know, everything still goes back to economic factor. So influencers will be employed. They can even come to me, I can employ them as well. That what he needs to know is that do not tell people as if you're a doctor.
Okay.
And then provide information based on what is fact. Do not use an inducing statement or enticing statement or pictorials to actually induce people to believe in what you are saying to be fact. So if an influencer can actually work with facts, get facts from the origin, all you need to do is to always reference it as, okay, I'm telling you about this product, it was made in so-so place, and doctors have done so-so research on it, and I can tell you I've found a number of people that have used it. So you can promote it in that direction. And people will know that he is not the one advising them from his personal experience.
Right.
He's advising them based on what research has done.
Okay.
Once research has been conducted and you find a fact, influencer can go anywhere to promote that research findings. That is how it works. People are beginning to make drugs that can treat HIV. You need an influencer that can actually say, oh, fine, when HIV came, we were told that there's no cure. They are beginning to get a light at the end of the tunnel. So, this drug has been tested in Uganda, it has been tested in Kenya, it has been tested in some place in Nigeria, it's been found that it's working, and a number of people have benefited from it. You can trace this, I have said, to so places.
I mean, those are facts.
Those are facts. Traceable. Exactly. So influencer can go any length to promote facts. Rather than position himself that, hey, come and see me. You see, I've been to America, I've been to Canada, here I was in California. You see, I've known everything. If you use this drug for 7 days, your prostate will shrink completely, and then you become, hey, be careful. Some have used the same drug and their kidney has knocked down. Go to the dialysis center. There are thousands of young, middle-aged, and old there who are now waiting for transplant on account of kidney shutdown. All in the name of one medication or the other. And I'm very sure for people listening to this program this morning, some that have been affected will actually testify to it. I remember some of those products that were being patronized all over. During COVID-19, a woman used some of this drug to the point the two kidneys shut down, and then she was sick, and she was mistaken to be having COVID. Only to discover after COVID that two kidneys were down and that she needed a transplant. So, but when you ask her, she's been on some of this medication for years, ages, thinking that it's going to do a miracle in her body. All is been promoted on social media that will work for some people. That is not a research base. So please be careful. so as not to allow social media to eventually destroy your health.
Right. Telemedicine is also now, you know, as part of what, you know, medical practitioners like yourself are also using. How would you place telemedicine vis-a-vis what we're talking about here?
Yes, telemedicine is it's a technological development that promotes health and ease life for human being. Okay, you can ask anybody in London today, you don't get to visit hospital on account of headache or have body pain, you will not get an attention.
Right.
You will have to book to see a GP. Because that tells that the paucity of doctors here is so terrible that you cannot come and overcrowd them. Therefore, telemedicine has now been promoted. Okay, you can go on and get a code, and then you can link up with the doctor, and tell the doctor all your complaint. The doctor will consult with you online. Now, I think there's a lady, I can't remember her name, who actually promote that in Nigeria. She's even been assigned to do that. So there are satellite sites where you can visit, where a nurse is stationed there, then the person that consulted with you on telemedicine direct to that location to receive your medication or injection, as the case may be. And if you need a procedure, you'll be directed to an hospital where a procedure will be done. So this has promoted to reduce crowding in the hospital or waiting time. Somebody wants to see a doctor for an ailment that needed an attention within 2-3 days, and because going to the hospital is going to wait and going to get an appointment of another 3 weeks or 3 months.
Right.
So you can go
through that route.
and you can get an attention. Somebody expert can talk to you and say, oh, what you have mentioned that's wrong with you means that you need to run this test, you need to visit a center, you need to be in social hospitals at social time so that this can further be treated fully. Okay. This has promoted health care system greatly all over the world.
Right.
And we begin to appreciate it more if we also
apply the same
method, because it's going to help a lot. Go to our general hospital, our teaching hospital is crowded to the brim. Right. Doctors are overworked and they're tired.
Yeah, Dr. Issa, as we close this conversation this morning, are there known global best practices that you're aware that Nigeria can also follow its pattern in regulating digital health information?
Oh, as we speak, I do not have one at hand, but I'll go back to the commission. What do you call them? Those that censors social media and electronic medias. That,
the NBC.
The NBC, exactly, and the others. That is need for them to actually come to the rescue of Nigerians. Many are actually dying on a daily basis on account of using social media influencers that actually create problem for them. There's need to begin to censor what you're actually saying and who are you as regard what you are saying. Okay. If it's not in your area of study or you're not licensed to be saying that, then you should be checked. Somebody should call you down or get your attention to realize that you are not eligible to be doing that. I think if other countries, you don't just come and begin to prescribe for people on Instagram that you take 2 paracetamol in the morning and take 4 in the evening and take 6 in the night and then the pain will disappear. You don't have to do that. Why in another country you cannot do that? Because somebody will pick you up and say, okay, what audacity do you have to be prescribing paracetamol of 2, 4, 6 for people just to make pain to disappear for that day, or in the name of trying to do what? To get people's attention. So when we begin to censor what people do and then call them to prosecution, to order, and then we'll be able to get it better. Other than that, this trend you have opened up, I can tell you from the little we see, it goes more, because every day in our consulting room, we see phase 1 or 2 patients that come to argue with us based on what is doing on social media. And we find difficulty in explaining to them they are most difficult to treat because they don't listen to us. They trust the social media more than the real doctors. So how do we deal with such people? Except there's a system that begins to check down those that are doing that job, so that such people that are attached to them begin to see that, oh, these people I've been following, they are just a bundle of lies, and then they can actually face reality on time. Okay.
We have to leave this conversation here this morning. Thank you so much, Dr. Mohammed Issa, a medical practitioner, for finding time to be with us on the program today. We appreciate your thoughts.
Thank you very much for having me here this morning.
Well, we've heard from Dr. Issa this morning, and he's helped us weigh in on this conversation today. And the bottom line is, you cannot totally swap the place of a medical practitioner with the kind of information you source from the social media. Those information, yes, are there, but you still need to speak with a real-time doctor when certain things are going on with you. Please do not leave these things till when there are complications before you go to the hospital. And like he said, it's best that you spend more money when you go to the hospital than to allow for damages to have been done, and then you'll be spending more for the remedy.
If only you survive.
That's another angle, if only you survive. All right, that's it on this side of the table this morning. We'll take a quick break. When the conversation returns, it'll be time for the Lagos conversation.